light. I will go. That's enough. In the mirror, wash off the dust. Do me nice. Don't interrupt. My birthday was in April. And then May is Mother's Day, and then June is Father's Day and my birthday, and then July is the month that I lost my mom. So these months always, except for like 1 year, have been tough. It's like I'm sleeping through these 4 months, and then I wake up at the end of July, and I've lost over half the year. So this year I wanted to be proactive. So I've been preparing for July, because July is when it really hits me hard, the month that I lost her. But I said this year I wasn't going to do it the way I normally do, eat my way through it. And I'm glad that I caught myself, because normally when I come out of it, I'm around 228 pounds. And today I weighed in at 223. So I caught it earlier, so I don't have as much weight to lose, but I'm trying to make it my mission to where next year I catch the symptoms earlier, so I don't fall back into the depression that causes me to eat, that causes the anxiety. A lot of us are having issues right now. And I was talking to an ER nurse yesterday that had read the same article, where they said that thanks to COVID, 80 to 85% of people will have lasting brain effects, which includes the depression, the anxiety, the insomnia, the mood instabilities. And for the people who already have those issues, that is just going to intensify it. And I can tell you, I'm getting a lot of calls from women that are having issues with anxiety, depression, insomnia, and mood disorders, especially those of us who are going through menopause. So I just want to encourage those people to make sure that you're doing something to pour back into yourself. Because for me, the things that I do to pour back into myself is I do things for my community. Like I like to make egg pies and pass them out. And I like to, there's a tea that I make that fights helps your immune system fight against all this shit that's out in the air. And I make it and go and pass it out to the community. And I also have a garden. I am growing the herbs that my community is going to need, because I can see now that a lot of people are not going to be able to afford their medications in the future. And we're going to need something to help them live. And I can see that a lot of people are not going to be able to afford to pay for that doctor's visit. So they're going to need something that's less expensive and something that doesn't cost as much. So I'm really trying to fix my clinic to one that can help those that can't afford it, because a time is coming, and it's not too far away, to where you're going to come down with something that when you get to the pharmacy, they're going to tell you $545 for it, and you're going to need that to live. And if you can't afford it, then you know, RIP, that's coming. And I've tried to get, even though it's very expensive, I've tried to get the pharmacies to stock up on the medication that would save your life, and they refuse. They actually tell me that they have plenty of the medication in stock, but they just refuse to order it and ship it. So since we know that they're not on our sides, we have to be on our own side. So whatever chronic disease you have, may I strongly suggest you find an alternative way besides medication and figure out how to treat it that way, because that's what it's going to come down to. So I mean, I need y'all to understand me when I tell you that you need to be making sure that you're on top of your health. If you have not had your labs done in the last 6 months, I highly suggest you do. And when you get that lab, I want you to do me a favor. I want you to ask for a CBC with a differential. That's very, 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 very important, especially if you are going to get your labs while you're sick or just following an illness. You want that differential so they can identify what caused it. And I'm really surprised that a lot of ERs are not diagnosing people with what they really have, because they're not running the proper labs. So if you're sick, a CBC with diff can tell them if what you have is the virus, if it's a bacteria, if it's because you're having an allergic reaction. So you really, unfortunately for you, you really do have to be more mindful of the things that go on medically, because there's a lot of people out there that are trained to do it that can't be bothered. Like the ER doctor that tried to send me home and tell me to take Benadryl pills when I was having a full-on anaphylactic shock, like my lips and my tongue was swelling, and she told me to go home and take Benadryl. So because of that, I just want to highly, 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 highly recommend that you take better care of your health, and that you have someone that you can call if you have to go to the hospital, if you have to go to the emergency room. You really need to make sure that you have an advocate that has medical knowledge, because I don't know if it's the school. I mean, the school that's training these people, or if I don't know if it's racism, but something is going on. Like in nursing school, I was told that it's airway, breathing, and circulation. So imagine my surprise when I go to the emergency room, because when my patients go to the emergency room, especially the one in the town where I live, I'm showing up or I'm calling because I don't trust them to take care of my patients. And so when I heard that she went to the emergency room, I was in Tenny Hall. I wrapped it up and got in there. When I got there, they had someone who has CHF and came there for complaints of shortness of breath, laying flat on her back with no oxygen and no monitors to monitor whatsoever. They had checked her blood pressure once, and it was stroke level. And that was an hour and a half, and they had never checked it again. So it's very, very important for you to understand that you need to be on top of your health, because the hospital is the last place you want to go, because it's looking like that's the last place you're going to go if you have to go there. If you know what I'm saying, I'm just telling y'all, a lot of people are not going to make it through these 4 years, and I do believe that is by design. Mm-hmm. So I need for you to decide that you're going to fight back. And how are you going to fight back? Whatever condition you have, you need to be on it. If you're a diabetic and you check your blood pressure every once in a while, but not really, I'm gonna need you to start checking them every single day. Because one thing that we've learned is that COVID, it shoots your blood sugar up. And when it shoots your blood sugar up so high, it's very, very hard to get it down, because it's not the diabetes that's making your blood sugar go up. It is the COVID. And then people are going to the doctors that doesn't realize that underlying issue with the exacerbations for most of the diseases right now is COVID. Like, we've had 5 years of this mutating virus going around, learning how to work in our bodies, learning how we treat it, learning the medications that we use. And so now we have what I'm calling the Trump virus, a superbug. It's learned our drugs, it's learned our bodies, and it's mimicking other things. And I really, 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 I keep having this dream that it's mimicking COVID. I don't know why, but I keep having a dream that it's mimicking COVID. And so we're treating it, cancer, is mimicking COVID. So it looks like cancer when it's really COVID, when they're treating it like cancer, but it's not helping because it's not cancer. It's really COVID. And I say that because it's still here. Thank goodness. I don't know if you guys can see this. This is a mark right here. I'm trying to show everybody right here. It's a mark. So after I had COVID the last time, I developed another symptom on my symptom list is hypersensitivity to a known allergen or a new one, which is not very, it happens. I talked to ER. I had never heard of it, but an ER nurse told me yesterday that it is possible for an older person to develop a new allergy. In my 26 years, I've never seen it, but she works in the ER. So of course she would know. So I'm going by what she said. She said that it's possible. Well, it's rare. It's happening more often now to where it's not considered rare anymore. A lot of people are having hives, don't know what lip swelling, rashes, and all this stuff, and not know what's going on. And I do believe that it is COVID. Like this, when it appeared, normally what happens when I start to get a rash is it'll start to burn, and I'll look at it and it'll have like an outline that's red and it's clear on the inside. It's never looked like a hickey or a pinch mark on the inside. And so I took that, I thought that was strange, but it felt like the others. So I started taking the antihistamines. I took some Benadryl, I took some steroids. Nothing worked. It got so bad and it was hurting. And it worried me because normally I don't even have to think about epi until it's, in other areas, but it was only here. And so I did take some epi, and it got worse. So something said that's not what you think it is. What's your next differential diagnosis? So I moved. COVID used to be the third thing, right? Whatever you presented with the most likely was number one, and then the second most likely was number two, and then no matter what, I always put COVID as number three. I can't tell you how many times I got to COVID as number three, so I moved it to number two. I'm about to move it to number one because I thought that this was a reaction to something that I was allergic to, and I was treating it as such. When something said to me, I'm gonna say God, when God said to me, that's not what you think it is, I got up and I treated it like it's COVID, and it started to go away almost immediately. I took some vitamin D, I took some vitamin C, I took some ivermectin, and I took some, I did the mouthwash with the scope. I did the iodine nasal spray, and it started to calm down. And then my husband had got me some Benadryl cream to put on it, because that's what I normally do. I put Benadryl cream on it and wrap it in plastic. So I put Benadryl on it, and it just started back up again. We were out now. Had to take my granddaughter to the doctor, and I was like, "Oh my goodness, I do not want to go to the hospital." So I started praying, like, "Please don't." And we found an herbal shop, and we went in, and do I still have the picture? I took a picture of the herbs because I used Chat GPT and asked it, Gemini, what are some natural herbs that I can use to block histamines? And it gave me a list of 3 that I could possibly use, but there was one whose name I thought was, there it is, Bakel Skullcap. That's the one that I wanted to find in the herb store, but there was the another one. I can't find the name of it. Blue something. I have it in my house. Yeah, blue. I don't know how to say that. Spirulina. And when I went there, this lady, she was in the herb shop. She wasn't really that knowledgeable about herbs. She just worked there. And so I was going through looking, and I seen the blue spirulina that I had seen on my list, but I went looking for the skull cap because I like the name, and I'm bad with names, and skull cap is something I could remember. But when I was looking, I seen the blue whatever on the shelf. I was like, that's the one that was one of the lists, and I went and verified, so I bought it. And then when she made the tea, she allowed me to use some because they had it right next to the creamer, so I assume it makes things sweeter. I don't know. I haven't researched it yet. So I took some and I put that in my tea and some honey and a cinnamon stick, and I stirred it around and I started to drink it. And as I drank the tea, the redness in my arm started to decrease until by the time I finished the tea, it was completely gone. And then when I got home, I took another Benadryl, and now the reaction part is completely gone, but I still have this as a reminder to take my antihistamines every day, because now that I'm more active in the gardens, we have several, I have to be proactive as far as my allergy medication, because like I said, I can't go to the emergency room because I can't even trust them to give oxygen to people that need it, or epi to people that's in anaphylaxis shock. So being mindful of your health is really the reason why I wanted to make this video today, because I wanted to have a first video on YouTube, because I got to get my YouTube channel started, because I got to get up to 10,000. Once I get up to 10,000 followers, I have an announcement for y'all that y'all are not going to believe, but I got to put the work in first. So I need y'all to help me. If you want to know what that announcement is, and I'm telling y'all, it's going to change the game, I'm going to need y'all to help me get my YouTube up to 10,000. So just go on over there, subscribe, like it, share it, do all the other type of stuff, so I can hear and tell y'all this good news. But that was one of the reasons why I wanted to do the live today. The other reason why is I wanted to have on record somewhere that I can keep, because I made a video back in 2020 where I was telling y'all all this stuff was going to happen. I was telling you there was going to come a time to where you were going to need to know how to heal yourself. I was telling you there was going to come a time where you're going to need to be able to make money, come out of your home and not have to depend on a job. I told y'all all this stuff was coming, but nobody listened. I told everyone before We've had 5 waves of COVID, 5. And before every wave except for the first one and the second one, the third, fourth, and the fifth wave, I warned y'all it was coming. I was like, hey, y'all, every time the numbers go down, COVID goes into the lab and figures out how it's going to come out and trick us to stay in our bodies longer to do more damage. And it happened. And it's happening now, but nobody is aware. It's because we're in a silent wave. Because number one, for some reason, I say it's by design, when the numbers started going up, they cut off our ability to see how bad it was. And then on top of that, 2 years ago, I said 2 years ago, COVID stopped testing positive, some of the variants. So a lot of people are going to providers who are not keeping up to date with it because they don't realize that it's still very much a thing, which I don't understand how they couldn't, but hey, that's neither here nor there. But if they're not keeping up to date with the changes because of it, they'll do a COVID test, which I say, if you go to somebody and they do a COVID test, I would exit stage left immediately. But they do those COVID tests and it comes back negative. So they don't even consider that what you have is COVID. And that is the reason why COVID is able to do so much damage in you, is because those COVID tests are tricking people into thinking that it's not COVID when it is. Because my husband had a toothache. It just came out of nowhere. But he said it was like a toothache he'd never had before, because it wasn't like in one tooth. It felt like it was in every tooth. He's like, it's all the way in the root and it's affecting every tooth. I was like, I don't think that's what you think it is. So we did some cloves boiled in water and put it in it, and then started treating him like he had COVID. And then he started to get better. But the thing that worried me about him, and I have his permission to talk about his medical stuff, is the thing that scared me the most is I could look, because of COVID, and I didn't mean for this to be a COVID lie, but it is. Because of COVID, I've learned other ways to tell if people are sick. I've learned to pick it up in their voice, and I've learned to see it in their eyes. I was fussing at my husband about something that I couldn't understand why. And when I looked at him, I looked in his eyes and I could tell he was not well at all. I looked in his eyes and it looked horrible. I was like, oh my goodness, how did I miss this? So I started assessing him. I made him have an appointment. And the thing that was weird was he was sweating. And when I touched him, he was cold. And his temperature was like 94. Now, we all know that temperature is how your body fights off whatever, right? If this thing has figured out how to lower your temperature, the lower your temperature, the more damage it can do, right? So if it can get your temperature down to 94, imagine the damage it could have done if I had not seen it in his eyes, that it was not just a tooth infection, it was something else. Because besides the tooth infection, he became extremely anxious out of nowhere. Like I was yelling at the girls because, I'm in one end of the house, they're at the other end of the house. I'm yelling at them to come do something. He was sitting right there and I yelled, he jumped. And he was like, it's because you yelling. I was like, I yell all the time. Like we're in this, and they're down there when I call for them, and you've never jumped. And we were in the car, and somebody called, and I told everybody to be quiet because I'm trying to run a business. And then I get on the call, they get in the back and start acting loud, so I go mute. Y'all see him on, and he jumped. I said, okay, so now you jumpy. Like you really have to be mindful that every little change in you need to write it down, because there are so many new weird symptoms that it's kind of getting harder to tell the difference between what is COVID and what it isn't. But in my practice, what I've learned is if you treat it like it's COVID, you can't go wrong. And the reason why I say that is because a lot of people had what I call COVID flu, is when you have flu and COVID, but you only test positive for the flu. And if you were to test, you would test negative for COVID. So the people who were testing and saw that it said it wasn't COVID completely eliminated the fact it could possibly COVID and treated it like the flu. And they ended up in the hospital a month later because it wasn't just the flu, it was really COVID. And I need people to hear that message, because that is the reason why a lot of people are going to, for social media purposes, I can't say certain words. I'm gonna say unalived, because I got banned on TikTok, y'all, for saying that other word. But if we don't understand what the possibility is, it could cost you your life. And I just want to say this to you: if you have to go into the hospital, ask them to treat you as if you had COVID, regardless of what it is, because it don't take much it doesn't really add much to what they have to do. And not only that, the treatment for it can also help be preventative, because if it's not gives you some prevention in case you come into someone that does have it. And I also want to encourage you to go back and watch my other videos that I talked about it, where I told y'all the equipment you need to have in your house. You need to have a pulse ox to check your oxygen. You need to have a nebulizer. So if you get congested and have issues, some medication can be called into the pharmacy. You need to have a pulse ox that's specifically for children. I know we're supposed to be boycotting Amazon, but at this point in time, we don't have a lot of time and to run around to different places. So until we get a Black-owned Amazon, I'm gonna keep using Amazon. And one thing that I recommend is having a PD one, because the last few waves were for us. This wave is for the elders and the children. The fact that the measles, I just got a notification that one of my licenses is going to expire next month. So that means I got to take some more classes. Yeah, I'm so tired. I lost my train of thought, but I'm not going to be on here much longer. What time is it? 8:34. Okay, I got to get to work. Just so you know, y'all, please, please, please do something to boost your own immune system. Do something to protect yourself from whatever's coming. Some things you can do is making sure that you're eating the foods that nourish your body and not just the foods that nourish your mind or help you with your anxiety. If you are snacking, if you're a stress eater, stress eat on some tomatoes. Those are powerful brain foods. Stress eat on anything that says berries. Berries is low in sugar and it helps with immunity and it helps build your brain muscle. So does fish, salmon, tuna. So does turmeric. I take turmeric supplement, added in food. What else? I already tell you about the vitamin C, the vitamin D, the quercetin. And if you are to the point to where every day you feel like you're having to push yourself to work, I highly suggest that you go and get some labs. I feel like this because I've been working around the clock because of the fact that a lot of my patients are sick, like never before. And we can't figure out what it is. So I'm just making them some teas. Based on their diagnoses, there's different things you can do. I've been playing with herbs. Yeah, that's really why I'm tired. And working in these, I got 5 gardens. Like, I don't know what I was thinking. All I know is I had a dream that there was going to be a time where people were going to need food. So I went and started, I have so many seeds. And now I'm putting them in the ground. So we've got one garden at my house, which is, they call it a witch's garden because I didn't do anything to plant it. I just looked out one day and realized that it was an herb in there and some berries in there, also some poison ivy in there. That's one garden. The second garden is the one that we put in front of the house. We had the onions, and we started with the onion, garlic, tomatoes and cucumbers was the first year we did. And then the next year we came back and we did the tomatoes, cucumbers, okra, greens, jalapeno peppers. So this year we're doing the same thing, but we've added an eggplant to the list. I don't know what I'm going to do with them eggplants when they're done. Somebody said make an eggplant casserole. I'm going to look that recipe up. I know how to make eggplant lasagna. Eggplant lasagna is actually pretty good, and it is so much easier. There's no cooking the noodles. There's no, baby, you just cut them eggplants up, slice them up, you wash them off, dry them, you dip them in the egg, and then you put them in the breadcrumbs and you stick them in the oven. If you want the exact recipe, it is over here on my YouTube channel. For those, I got YouTube going here and Facebook going right here. The eggplant lasagna recipe is in the in my video, so you can go over here and you can watch it. With that being said, what else do I have to say for this week? Look out for your elders. Please look out for your elders. One way not to have to worry about Medicare is to get rid of the elders. If all the elders are alive, then they can do whatever they want to with that Medicare money. They don't have to pass a bill to take it, because once we unalive, it's automatically theirs. So please watch out for your elders, especially the ones that are independent, because one of the main things that COVID does is messes with your hear. And we've been getting a lot of newsletters about how COVID is causing cognitive issues. And if you're elderly and you're living alone and you start to have cognitive issues, that can be very dangerous. So if you have elders, please check on them. If you can't check on them, give the name to the church and ask them to check on them. But we do need to be checking on our elders, because these last 5 waves, we don't have very many left. Like, I lost my last living grandparent in 2020 around the time of COVID. She went in the hospital. Well, she actually went to the nursing home first, and I didn't like what I was seeing in there. So I started questioning them about their COVID policies, and they kicked me out as her provider until they said she had to use somebody else. And the next thing I know, she was in the hospital. And then after that, we lost her. So please, please, please look out for your elders, especially if you got them in a facility. If your elders is in a facility, I suggest you start making more frequent trips and making sure nobody's there, because they will let people come to work sick. How you let folks come to work sick around elders? That's why we lost so many. I know one facility here in my town, they lost 11. And I was talking to a patient the other day who does home health. She said she lost 4 in one day. So we are in a COVID wave right now. I don't know when it's going to be announced to the world, or when y'all going to wake up and see it, how many more people we have to lose before y'all realize that we are in a COVID wave right now. I'm just hoping and praying that it's not astronomical before folks wake up and realize, hey, if you ain't doing something to protect yourself, you will, but you might not live to regret it. And that's the best way I can put it. I'm gonna say this and I'm gonna end. The last COVID wave that we had, I almost lost my mind. Like, I literally was this close to snapping up here because I could not handle it, because I had a fear of falling asleep. So I was having insomnia. And then I was having anxiety and panic attacks, because every time I would go to sleep, I would wake up and I would come to work, back to work, and there'd be 20 or 30 people waiting in my waiting room. We have virtual waiting rooms. And so I would go through and look and see if there was somebody sicker to move to the front. And every single time I found somebody that was on like day 4 or 5 of symptoms, and they were really spiraling, their O2s were dropping. It was getting harder for them to breathe. So because of that, I developed more anxiety of sleep, where I felt like I couldn't sleep. I was seeing patients around the clock. Like, I could not rest, because every time I would like clear my waiting room, I would go do something and come back. There's 10, 15 more people in there. I don't know how many providers we have left, because we did lose a lot during those waves, because some of us caught COVID and didn't make it. Like the Black lady who was on the video, who was begging them to treat her and begging us to call up there and ask them to give her the medication that she needed, and even said the doctor told her that she needed that medication, but he didn't feel comfortable giving it to her, and she died. She unalived. So we cannot get sick enough to get to the hospital. We have to make sure that we are boosting our immune systems and that we're checking our family members. And the thing where we go wrong is we wait for one person to get sick enough to say something's going on. The thing with COVID is everybody in the house can have one symptom, so it goes delayed longer. Like, one person will have diarrhea, another person will have a sore throat, another person will have a mild cough, another person will have increased abilities finding the correct words. If somebody that you know that's normally If you see them slow down, like what work, that right there is the telltale sign. Every single time I'm doing assessment with a patient and they're talking about what their issues are, these newfound issues, and they don't know what's causing it. And I'm trying to decide if it's something acute, if it's COVID, or if it's long COVID or long vax. The differential diagnosis list used to be just 3. It's not 3 anymore. Whenever they get to the point where I'm, interviewing them and I'm asking them questions and they have to stop thinking, especially when they're whatever word they're looking for. Like if they're looking for the word fight and they keep saying flight or a word that starts with F, that's that COVID fog. And that really is how I was able to find out that COVID was not testing positive anymore, because people that had the flu also had COVID fog. COVID fog was only with COVID. So if you got the flu and you got COVID fog, it means you got COVID flu. So you need to treat it as both. And the thing about it is the same treatment for flu is the same treatment for COVID, ivermectin. They probably gonna take my page because I said the medication name. They don't want us to say the name. I'm saying it because I am team I don't give a fuck. If you don't listen to nothing else I say, go back and listen to the name of that medication and have you some on stock. Ask your doctor, if I caught COVID, would you prescribe this medication for me? If your doctor says no, find you another one. Find you another one. I can't say that enough. If you go and you sick and your doctor tries to give you a COVID test, find you another one. Because there's no way to know if you really have it, because there's so many variants that don't test positive. Y'all remember that each variant that you know about that's causing problems and the ones that you don't know about that's not causing problems, all of those have the possibility of making 30 new variants. And they have been doing this for 5 fucking years. And that's why I'm so tired, because I keep telling y'all, hey, this stuff is out here and it's going to get bad if we don't stop it. Nobody would listen. Every time I try to tell somebody, hey, I think you had COVID based on your symptoms. Unless if you can't give people a positive COVID test, no matter what you tell them, they don't believe it. And it's destroying the insides of their bodies. And I'm watching them get weaker and weaker and weaker. And I'm saying, hey, are you ready to accept your diagnosis yet? Are you ready to accept the fact that your immune system is no longer working? So every time you go out somewhere, you're exposing yourself, because if you have the COVID in you, your body is very weak. If you go out and you get close to somebody with a different variant, or God forbid the measles, because that's still out there, or God forbid the hantavirus, because that's still out there. God forbid TB, because that's still out there. God forbid H1N1, because that's going around. God forbid something else is introduced to you while your body is fighting off the COVID. That's not going to end well for you. It's not. Because even if you do survive, the damage that it will do will affect your quality of life. If you're used to going to work and then you end up with kidney failure and now you have to go to dialysis 3 times a week, 4 hours a day, where they remove all the blood from your body, clean it and replace it. You think you feel like going to work after that? A lot of the patients after the dialysis treatment, I would have to wake them up because, I have 2 sets. You get them up, get them out, and the next one comes in. Those people, they so weak and tired, they sitting there sleeping, and you trying to get them to get up out the chair and leave and wait so you can close that note and bring the next patient in. Dialysis is not good quality of life. And the thing of the matter is the majority of the patients in those dialysis units are Black. If you don't believe me, if you're driving by and you see Fresenius or DaVita or any of those dialysis clinics, stop and look and see who's going in and out of there. That's Black and brown folks. That's because blood sugar, our bodies are more sensitive to sodium and more sensitive to sugar. And because of that, our blood sugars are higher, our blood pressure are higher, and that's the number 1 and number 2 killer of kidneys. Unaliver. I forgot, I can't say. Free speech is a myth. There's no such thing as free speech anymore. You can't even say colors on TikTok. Like, you get hate speech for saying the word white on TikTok. Yeah, you have to say white tea or sun dodger or something else. Because if you say the word white over there, they will report you for hate speech. It's like so crazy. They tried to start it where you couldn't say the word black, but I'm just like, I'll be damned. You're not going to tell me that I can't call myself black. I don't give a fuck. You can kick me off the app because I'm black. I'm not BLK. What the fuck is that? I'm not BLK. I'm black. If I can't say that color, then I'm not welcome in your space. I'm cool with it. I don't give a fuck. TikTok ain't paying me no way. They as soon as Meta, which is Facebook, and them joined up, all my videos start doing the same thing that they do over there on Facebook. I have videos that got up to 10,000 views, and I start clocking my money, and then they go to zero, so they wouldn't have to pay me. So that's the reason why I don't put forth much effort in the woman-to-woman weigh-in Wednesdays, because I was done fucking with Facebook. I was. And then somebody told me to come over on YouTube. So I was like, okay, well, I'll come to YouTube and try to build over here what I had done over there. Because like right now, I'm on YouTube and I have 0 people watching because I don't have a following over here. And I have 2 people watching on Facebook because I haven't been over here that often. And I don't feel like fucking with TikTok today because that's where my audience is. If you really want to find me, if you're looking for me, I'm on TikTok arguing with people who don't know what the fuck they're talking about, telling folks shit that's going to get them killed. Unalived. There's a lot of people out here listening to people that have doctor in front of their name on social media. Guess what? You don't have to have a doctorate to say you're doctor whatever on social media. So please be very mindful who you're getting your medical advice from. There are some people that have seen so many psychiatrists in their lifetime that they feel like they have enough information to give it to others. So they stick doctor in front of their name. People are not asking, what kind of doctor are you? Where you went to school at? Or not even realizing that the shit they say don't even make sense. Like not even common sense. So I know you're not a real doctor. Like, and that pisses me off because I refuse to get my doctorate, because if I got my doctorate as a nurse practitioner, I'd have to tell you every single time, if I'm doctor, whatever, as a nurse practitioner, we have to end it with the fact that we're a nurse practitioner, but no other doctor has to do that. That is so disrespectful on so many levels. That's the reason why I do not want to get my doctorate. And another reason why is because I don't need it. I'm in my own clinic. So if getting my doctorate meant I wouldn't have to pay a collaborative or wouldn't have to have a collaborative, I would have already had it. But that doesn't even benefit those of us who have, those of them, because not me, who have their doctorate. Having a doctorate, I don't think you should have to have a collaborative. I mean, there should be some benefit for you going above and beyond to get the highest education possible for your specialty. If you have a doctorate, I don't think you should have to have a collaborative. They should get something for being a doctor, especially since they're not allowed to call themselves doctors with all the pushback. That's neither here nor there. That's something else that I said that I was going to do. Another thing that I was going to add. I don't know when I'm going to stop fighting, but I love advocating for people that need it. Like, I think that's why I am such a good nurse. Because if your doctor don't know what they're doing, trust and believe, I'm not going to let them harm you. Number one, if something happens to you, that's the nurse's license, not the doctor's. I know that sounds crazy, but the nurses are held at a higher standard because we're expected to know the same information that the doctor does. If the doctor tells a nurse to do something and the nurse does it and it causes harm to the patient, the nurse gets in trouble. How she was supposed to know that not going to medical school, I don't know, but that's just the way it is. So y'all honor your nurses because they really out here saving lives, like literally saving lives. Because these providers, it's overwhelming. It really, really is. And you need to have somebody there watching to make sure you're not making mistakes. Because like I said, COVID is cognitive as well. And a lot of times you don't realize it until you're in it. Because the first time that I had COVID, how I knew was because of the symptom of COVID fog. I had someone who had came to me to admit them, and I did, and they started getting an attitude with me, and I didn't know why. And then they came up to me and just said, hey, I wanted to see you, whatever, but you did some labs on me, and you ain't giving me no results. I was like, I ain't did no labs on you. And they looked at me, it's like, are you okay? Because you did do some labs on me. I went and looked, and sure enough, I did labs. And then I really knew that I had it because that day I was like, okay, let me go home because if I'm making mistakes like this, I need to go and rest and recoup because people's lives literally are in my hands. So I cannot be, distracted. And then I went to go home and something told me to go back and check my refrigerator. And so I got out the car and went back, and I had left my medication out that I had just spent over $1,000 on top of the refrigerator. Yeah, that would not have been good. Because that money that was going to come from that $1,000 was paying my rent on my office space, my mortgage. I don't have a car note, but it pays everything else to keep the clinic going. That could have ended me. So I'm so glad that God whispered in my ear to go back and check on the refrigerator. Because when I heard go and check on the refrigerator, I was like, I ain't know in the world I left that medicine. I ain't. And then something was like, okay. So I was like, you know what? Let me go check. And sure enough, I didn't even put the medicine in the refrigerator. I put it on top of the refrigerator. So I knew that there was some fog going on. And so I went home and started vitamin D, vitamin C, scope, nasal spray, like nebulizer with the oil that I make in it. And this has been very therapeutic for me, like for real. And there's another reason why I used to do these every Wednesday, because they allowed me to vent, which allowed me to carry on. And I really think that I need to make sure that I'm doing these again. So if you enjoy this, and if anything that I said razzle dazzle your spirit, you can give me some stars. You can subscribe to my channel. You can tell people about me, because you're going to need somebody who is actually actively looking for the information, since they cut it off to where the CDC and WHO used to send it automatically. So now the only people are getting it are the ones that are going looking for it, and not many people care to look. So you need to make sure that you are connected to someone that is willing to look and then come back and tell you what the real deal is. Because even though they're not saying it, don't mean that COVID ain't out there, because it is. It's out there, and it's out there because we're getting a lot more unexplained deaths. We're getting a whole lot more unexplained deaths. We're getting a lot more suicides. One thing that COVID does is it intensifies any condition that's already in your body. So if you're already depressed, if you get COVID, it can make you suicidal. We have to be mindful of that very much. If you see somebody that's always irritated and agitated, if you're bipolar, or even if going through menopause, if you get COVID, it's going to make them mood swings 10 times worse. So make sure that you're not only watching yourself, that you're watching the people in your family, because sometimes folks can't see, themselves. Because when you got to do something, you'll do it not realizing that you actually putting all your energy into it, because your body is completely zonked out. Make sure that you are looking out for yourself, and make sure that the people that you're looking out for are looking out for you. Because a lot of people are falling off the cliff because they are at the edge trying to save somebody else, while that person waits for them to get close enough to the edge so they can push them over, because they never liked them anyway. A lot of people are suffering right now because of the people that you think that are your friends only became your friends so they can get close enough to you to get some information to ruin you with. So just be mindful of your boundaries, be mindful of your medicine. I just pray for you mentally, physically, financially, and spiritually, because these next 4 years, a lot of people are not going to make it through if they don't start listening to the right people and following the right person. A lot of people following the devil. A lot of people are chasing money. If people chase God as hard as they chase money and chase men and chase women, the world would definitely not be in the position that it's in right now. Because I can guarantee you the President of the United States has never chased God a day in his life. The people that follow him has never chased God a day in their life. Y'all need to make sure y'all following folks that's chasing God. Because if you're following somebody that ain't chasing God, I guarantee you're going in the wrong direction. And with that, I'm going to go ahead and end my live, because this God chaser got some lives to save. Y'all be blessed. I hope you come back next week. I think 8 o'clock is going to be my normal time. I'll be razzle dazzled and ready to go, because I was up all night, y'all. I'm so Tired, but I'm excited. I am actually turning my clinic into like an herbal store where you can come in, and depending on whether you want medicine or not, we can sit down and do a consultation. I go over the medications you were taking. I look at your labs, and then I come up with a plan on what herbs or teas you can. Well, I don't know why I did that, because they really are teas. Like this morning, I took some goji berry, some mullein. What was the other one? Oh, and oregano tea. The oregano doesn't taste very well. I tried a squeeze of lemon in it, and cinnamon. I need to get some more ground cinnamon. Why did I take those things? Because I needed some energy. I needed some focus. And oregano is a cancer fighter. If you're not doing something every day to fight cancer in your body, I don't know if you don't know, but the numbers of cancer are through the roof. You need to be taking something, doing something to try to prevent cancer in your body. And the scary part is people are popping up with stage 4 out of nowhere with no family history. Like I said in that video that was mysteriously deleted, I believe that there was something in the jab that turned your immune systems off. And that's exactly what happened. Immune systems are turned off. People are being diagnosed with cancer in late stages, and then no matter what they do, they're not making it. So make sure you're doing something to protect yourself and take care of your health every single day. If you have blood pressure, blood sugar issues, make sure you're checking them every single day. This is one day skipped. It's my husband. What's your blood sugar? It's all right. What was it? Oh, I don't know. Check it. 300 and something. Come on, y'all. I don't want to be a dialysis wife, taking him back and forth to dialysis. Then he has no energy to do. I'm trying to stay active, proactive, preventative, so we don't get to that point. If you are not doing something to prevent bad health is going to find you. And with bad health comes bad wealth. So if you can't work, you can't eat. They're cutting off Social Security, they're cutting off benefits, they're cutting off SNAP. It's getting to a point where no matter what age you are, if you can't work, you can't eat. So make sure that you're taking care of your health. And with that, I bid you a day. I hope you have a blessed day on and with purpose. Bye. Let's see. Finish. Thank you. End stream. This is my first YouTube live ever. Oh, okay. I thought I had already.